Hi, mamas. Rikki Cortese here. For those of you who do not know me, I am the co-owner of CTS Fitness and Performance here in Napa, California, a personal trainer and a pre-postnatal fitness specialist. I have a very special guest on with me today, Dr. Christine Pieton. And hi, Dr. Christine. How are you?
I'm doing well, thank you. How are you, my dear?
I am hanging in there in the midst of quarantine.
Yes, Coronication. We
Oh
are in
my
the real
gosh.
right now. For
Oh my
anyone who catches this later on at a point, you'll know kind of where we are, sort of in the very beginning stages of this
timestamp
quarantine.
this.
Yes.
So thank you so much. I know you are a busy professional, and I'm just so excited to have this conversation today, all things pelvic floor related, linking, return to running. But I would love for you to give us sort of a background on your education, your experience in sort of the women's health world. And I went on your
Absolutely.
website and you have a number of accolades, which are extremely impressive. So tell us a little bit more about yourself.
Well, thank you. First of all, thank you so much for inviting me to have this discussion and to give me an opportunity to share this really important information that I feel like for me as a healthcare professional, and especially as a women's health physical therapist, this information I feel like right now is still privileged information versus just general access to this information that I think all women deserve to have access to. So thank you for helping to bridge this gap between information that should be accessible to the masses that is not quite yet there. Um, my name is Dr. Christine Pieton, and I am a sport and women's health physical therapist. I went to school at Emory University for my doctorate in physical therapy. And through that education process, I was strongly convinced and focused that I wanted to be a sport and orthopedic physical therapist. I've always been an avid runner ever since my high school years of being a cross country athlete, and have always used running as just my own favorite form of exercise and stress management. And it was just something that I always loved from a personal level. And then in PT school, got to love it from an entirely different angle of biomechanics and injury prevention and overuse injury education and all of those additional pieces. So I kind of just took my favorite things, blended them together, and kind of started my career out of school as, you know, on that track and helping a lot of runners get back to running or helping them to improve their running mechanics. I will be honest, I never had any inkling that I would end up in the women's health space. Women's health physical therapy and this specialty is not something that is in the regular PT school curriculum yet. I don't know if it will ever eventually get integrated, but just for clarification for people who don't know how our specialties work, this is something that clinicians specialize in after PT school. So it's something that we go to advanced coursework and training to learn about this after our graduate level education. I was fortunate enough in PT school to have one special 3-hour lecture from an alumni who happened to be a women's health physical therapist, came in, shared with us what she did, shared with us the importance of the pelvic floor. And I remember sitting there thinking for most of the 3-hour lecture, holy cow, there is no way that I would ever want to treat this area. I can't talk to people about those really intimate details. I can't imagine talking to somebody about bowel and bladder function, sexual function, like having babies. Like, I'm so glad somebody wants to do that. That is not my wheelhouse. I do running and sports. That's so not related, was my very naive way of thinking at the time. And I was like, so glad I know this. I'll refer out. This is not my jam. Fast forward like a year and a half into practicing and working with my runners, loving it. And I had a couple of my mamas of two parties. One, we got them back to running. They were doing super well. And they're like, oh my gosh, this has really also helped me. Like, I'm not leaking anymore. I feel a lot stronger. My hip pain that I used to have after my baby like is gone. And I was like, ooh, what? Okay. I was not knowing that that was a thing. And then the other half, we would get to a point and then we would keep kind of hitting this wall of not being able to progress. And digging further, realizing, okay, I think our break point here and our barrier with some of my other runners who weren't able to progress happened to be related to pelvic floor issues. So at the time, I remember kind of sitting there and going, okay, there was nobody in my clinic at the time where I was working that was going to be able to help me bridge those questions. And I don't like it when I don't know the answer to something. So I dug into Dr. Google and all the reading and all the things and what do I need to do to fix this problem? And eventually decided, okay, I need to go and take a pelvic floor course. And I'm just going to take a course and I'm going to just gather some info, was sort of how I was still mentally preparing for this. And I went to my first 4-day course, and within the first 20 minutes, our lecturer jumped on and she goes, okay, like we've gone over this thing. Let's do our first pelvic exam. One person's up on the table, one person's the clinician, go for it. And I was like, oh my God, I've barely introduced myself to this random clinician next to me who signed up for this course. Here we go. But after that 4-day course, my heart was just like, I can't not treat this. Like I have to specialize in this area and I have to do all these courses. And this is totally related to running and my specialties. And I can't even imagine that I didn't realize that this was totally connected to everything. And so that kind of started me on my journey about 3.5 years ago. And so over those 3 years, me as a clinician, I've transferred out of an outpatient kind of clinic practice. I started my own. I'm a one-woman show, and I work with all of my clients one-on-one. I'm also a Pilates instructor, so I use Pilates as a movement and re-education tool to help my mamas to be able to recover from postpartum challenges, as well as to support them through pregnancy, and then to bridge the gaps in between all of that to help them get back to whatever activities that they're feeling limited by. So that's kind of where I'm at.
So cool. I love that you are a certified Pilates instructor and you incorporate that into your practice, because I feel like that's very realistic and something that the moms can take home with them. Because a lot of times, from my experience going to a pelvic floor physical therapist, you're working a lot on your back. And it's like, is this really functional for everyday life for a mom? So I love that you're incorporating Pilates-esque into your practice to have more kind of like a realistic approach to rehab. I think is so beneficial for moms. So
100%.
Awesome.
Yeah.
Can you tell us a little bit about what a visit might look like in case someone doesn't know what a pelvic floor physical therapist really does? And if they may be bashful about their lady parts, and if you can do an external exam rather than internal, just what that visit might look like.
Great questions. So yes, a traditional kind of pelvic floor physical therapy visit typically involves an internal exam. However, I always say, and I even clarify this with my clients, this appointment is for you. If you do not feel comfortable with an internal exam, we do not have to do an internal exam. There are some cases where my clients don't feel comfortable with that, or maybe it takes a few sessions for them to feel comfortable with that idea. So we can do a lot in terms of just external assessment, and that doesn't even have to involve an external assessment of the vaginal area. That can mean an external assessment of how does your body move in space? How do we squat? How do we balance? How do we perform just basic day-to-day movements like a lunge or picking up something off the floor, pretending that this kettlebell is your baby? How do we pick them up? How do we set them back down? How are we moving in our regular day-to-day life? Because for me as a physical therapist, my number one goal is to help understand how is this individual's body moving and how do we make it more efficient for them to be able to do whatever it is that they're not able to do without pain or confidence or dysfunction like leaking or bearing down or anything like that. So there's a lot of pieces that we as physical therapists and also pelvic floor physical therapists are looking at. So there's always usually a movement assessment of how does your body move in space and how do we lift and load and move. And then also a component, if the client feels comfortable, to do an internal exam. The internal exam is likely what you think. We as PTs will typically have you lie on your back. I am gloved, and I always verbally talk through with my client first what I'm going to be doing and explaining to them the purpose of the exam and what we're looking for and why, because I think that's really important to understand. Okay, you're doing an internal exam, but what are we gathering from that, right? And how is that helping them to develop a plan of care to address whatever symptoms that they're coming in that they've been, suffering from. With the internal exam, there is an external kind of tissue assessment component where I'm kind of palpating the tissue there and also looking at the skin integrity, because I can get a lot of information looking at, is there a lot of vaginal dryness, or sometimes we can have some different kind of skin irritation and things like that. So I can kind of see that. Sometimes I'll need to refer them to their OBGYN if I notice anything that looks abnormal or suspicious, and I want them to go get that checked out. And then with the internal exam, I'm assessing kind of the vaginal opening, and especially after mamas, if they've had a vaginal delivery, and especially if there's any tearing or scar tissue, being able to assess that scar tissue is super important because that impacts the quality of that pelvic floor contraction. So I'm looking at that, and sometimes that can be also super sensitive, which can create pain with intimacy, as well as just pelvic pain with exercises and stuff like that. So I'm looking at those different components too from an external. And then the internal exam, like I said, I usually have 1 or 2 of my fingers. I'm gloved and I use lubrication there. And I very slowly enter the vaginal canal there and do kind of a sweep through to assess the different layers of muscle tissue through that vaginal canal to assess for other things depending on what's going on. And then in some cases, there can also be a rectal exam. Again, depending on symptoms and things like that. Sometimes if people are having difficulty with bowel control or anything related to kind of posterior pelvic floor pain or dysfunction or issues, sometimes a rectal exam is also part of the recommended exam. So just depends on what we're working on.
Awesome. And as you can see too, there's no TMI, right? There.
Nope.
Even
we
with
talk about all the things.
I've heard, but at this point, pretty much everything. And so this is, I want this to be a normal conversation to have. Can be very, mothers especially, can feel very self-conscious and not want to verbalize. But let me tell you, there are many women experiencing the same thing that you are. And so I want to normalize this as like, it's okay to talk about, because there's a lot of help surrounding these areas, which brings me to my next question. What are your patients primarily coming to see you for, or is there like a trend or a commonality with symptoms or pain management? What does that look like?
Great question. So I find I have a few categories, if you will, that often bring people into my office. One, I often kind of hear from my mom is like, I just feel like my body's not bouncing back like it's supposed to. And that phrase, bouncing back, I also wish that we could just like erase that off the board. I feel like I hate that statement because it's not supportive in the sense of, a mama's goal should be to bounce back. No, your job should be to take care of yourself. You just did this incredibly amazing thing by growing a human from scratch and then brought this human into the world. Your goal should be to take care of you and your baby and to help your body feel reconnected and strong. That is the goal that I want for my mamas, so that they feel strong both emotionally and physically to be able to do all the things that you're doing, because mamas, you are a freaking endurance athlete. Okay? If you don't think you are, I'm here to remind you that you are. You are carrying and loading and all day long in various positions, various environments, often maybe with one baby on a hip and maybe another one that still needs another part of your body, and cooking dinner and trying to, be a boss of all the other things in your world. It's a lot. And we are not doing this in a short time frame. It's all day long. Okay? So this idea of bouncing back, I just feel like does all of us as ladies a huge disservice and puts the focus on something that is not fair. And you also just created a human that took 9 months to build and create. So the idea that you should bounce back quickly is also BS, in my opinion, and also unfair in terms of how we think about that recovery process. So I just want to put that on the table. Another reason why people will often come to me too is that they have questions about what's safe or not safe in terms of exercise, because there's so much conflicting information on Dr. Google about what we should be doing or not doing. So sometimes those questions, are bringing people into my office, or they've tried to go back to exercising and stuff just doesn't feel good, or it's created pain and things like that. So they're coming to me for guidance. And then also I have some of my mamas too that are suffering from things where they feel shame or embarrassed about, most commonly leaking with exercise or running. And leaking could be urine or it could be bowel. So both of those situations can happen, and that's often related to just pelvic floor challenges that aren't able to operate or regulate properly. And so assessing the why behind that. And then also, I work with a lot of my mamas too that have a lot of shame or embarrassment or frustration around pain with intimacy, especially after having a baby. And that's another big topic that we don't talk about and that we don't normalize. But a lot of mamas develop that after having a baby, especially with vaginal deliveries, but also C-section deliveries can result in that same situation. Different mechanism for why it's uncomfortable, but still common. So I feel like there's a big misunderstanding in terms of if I had a C-section, then that means that my pelvic floor should be totally, unaffected. Not true at all. That pelvic floor still had to work extra hard through those 9 months to support everything. So it still had to undergo stress for those 9 months. And then when we have a C-section, that abdominal wall for a few months is healing. And so the pelvic floor actually has to work harder to provide support while that abdominal wall is not able to. So that impacts the pelvic floor from a different angle than a vaginal delivery does. So lots of different reasons why I have my mamas come into my office, but those are kind of common ones. And then being a postpartum running expert, I am sought out in my community a lot for the support that I bring to my mamas to be able to know how do we gradually return to running and how do we do it safely and effectively. So those are the kind of common ones, but there's obviously a blend sometimes of those things.
No, you've hit
those are kind of the main ones.
Really big topics. Yeah.
Yeah.
Leaking, prolapse, pain with sex, scar tissue healing. Oh my gosh, there's a lot. I mean, that can be like another conversation for another day too. We can dive deep specifically into each topic because it's a lot. Women have to deal with a lot.
Yeah. And then we're told just bounce back. It's fine.
Right.
Oh, okay.
Like, Oh my gosh. So this is
100%.
this is what I can tell your passion, and I'm super passionate about this because with my first, I was completely clueless on how to return. My short little blurb about my story with my first, I ended up having an emergency C-section. Did not expect that whatsoever. And which brings me to my question about the 6 weeks. So now I think it's as early as 4 weeks. Sometimes I've had clients come to me being cleared at 4 weeks, but I mean, the general is between 4 to 6 weeks. Your green light, your clearance. So let's talk about what does that really mean? What is the green light for? What is that permission to do? Because I feel like that for a lot of moms, especially athletes, that's their permission to just jump right in, full go, do what they were doing before because you don't really know any different. And if they have that mentality of I want to bounce back, I want to feel like my normal self again.
Right.
Where is that? Is it a yellow light? Proceed with caution? What is your philosophy on that 6-week clearance?
This is such a great question. And I have lots of opinions about the 6-week or 4-ish week postpartum checkup. So in my professional opinion, that 4 to 6 week checkup point is a green light for that mama to connect with a pelvic floor PT. If I were in charge of rewriting the women's health plan of care and the standard of care here in the US, that is what I would equate to what that green light means. It is a really misleading all clear, because if this was not my specialty, I would also interpret that all clear, ease back into things as, okay, I'm just gonna, I'm gonna go back into everything and just see how it feels, right? That's really unhelpful. It doesn't give you any guidelines in terms of how you're supposed to do that. And also it's telling you to ease back into activities in a completely foreign body. Okay?
Absolutely.
And I say that with love. A foreign body in the sense that you just brought a human into the world, possibly C-section wise, where your abdominals have been completely cut across. Okay? They are healing. And or vaginally, which also was undergoing healing, whether or not you were able to have a vaginal delivery without tearing, that tissue still got stretched mega hard, okay?
Mhm.
That tissue still needs time to heal. And at that 4 to 6 week mark, none of those tissues have reached full healing maturity, okay? So we're telling women that they have the all clear when their tissues are not all clear. So that is not helpful.
So many gray
Okay?
areas, so vague.
Yeah. So vague, so unclear, and also not enough good information to help an individual make good informed decisions. I had to go to graduate school and then some to learn what I know. And now we're telling women who don't have any of that background or education to ease back into stuff and assume that they should be able to problem solve through that process well. That's not fair. And in my opinion, that puts all the pressure back on the woman to make the decisions. That
Absolutely.
does not support her in her healing.
That's one of my missions too, is to kind of change the postnatal care protocol. It should
Yeah,
be standard care to see a pelvic floor PT. Just automatically, that's your next step after you
automatically.
see your OB or midwife, whoever.
Yeah,
And what's hard and frustrating is that we go back to the whole privilege thing. Not everyone can afford or will choose to see a
yes,
pelvic floor PT. So then there's that disconnect of care. And
correct.
that's why this education is so important as much as possible, just to guide them, give them some direction.
100%. And the other challenge too is so many medical providers, i.e., OBGYNs, don't even know that pelvic floor physical therapists exist or that this specialty exists to be able to guide patients back. So I also, in this discussion or discussions about these types of things, I also feel like it's our job to really advocate for our female ladies, our fellow females, I mean, and say, look, advocate when you're at your postpartum checkup, ask for a referral for a pelvic floor physical therapy appointment,
100%.
period. And don't be surprised if you have a medical professional, i.e. your OB, who says, why do you need that? Or just do a bunch of Kegels, and if you're still having issues later, then we can talk about a referral. Push back on that. You do not need to wait until things don't feel good. You deserve to be able to have the support from day one to help you develop a plan to get there.
100%.
Women, we suffer enough. We don't need to add more suffering to the situation. Okay?
I say be proactive and fight for
Yeah.
it. You have to fight for yourself and don't take
Uh-huh.
no for an answer. Like if you really want the care,
No.
like fight for it. Yeah.
And here's another piece too. If you get a lot of pushback, I advocate for my patients to say, hey, if a provider doesn't want to give you a referral for something, I hope it doesn't get to this point. First of all, if this happens, I encourage you to get a different provider because your provider should be advocating with you, not
Mhm.
against you. But also two, ask for that medical provider to document in your chart that they are refusing to give you a referral for something. That
Mm.
will immediately automatically get you the referral you want, because
Okay.
that provider is not going to want to document in your chart that they said no to your referral.
It's good to know. It's a
So
good
know
little
that you can gently advocate for yourself in a
good.
proactive, polite way, but still in a way that gives you the support that you need.
Cool.
You deserve that. Yeah.
Good. So now we're getting into your area of expertise. I have a
Yeah.
lot of moms that want to return to running, whether it's just for pleasure, for fun, or competitively. And
Yeah.
oftentimes that is the number one thing or exercise that we kind of jump into after having a baby. I
Yes.
am going to raise my hand and say that walking was like the very first thing I did like 4 days after delivery. So I want to ask you, is that a great first step? Is it beneficial? Why might it not be beneficial in some cases? And just give me your take on kind of returning to running post baby.
Totally. So, returning to running post baby, I'm going to kind of talk in general terms, obviously, but with the caveat that everyone's return should be individualized, because there's so many different factors in terms of, how was each mama's pregnancy? Did they have complications during that? How was delivery? The type of delivery we had also impacts my recommendations for this. C-section or vaginal? And then also, were there complications with the C-section or with the vaginal delivery that also impact our healing time, and what activities are more appropriate when? So with that being said, walking, yes, within a certain volume is absolutely appropriate and helpful. And also, our bodies were designed to move. We need to start guiding women back into that movement process sooner rather than later, and also not making them feel like they are broken and fragile. Okay, because from day one, you're having to be holding and carrying and doing all of these activities from the moment you go home, or I would say even from the moment you're in the hospital, starting to potentially practice breastfeeding and having to get up out of bed, to be able to be discharged and things like that. However, I think that there's still, again, not good information in terms of how do we guide women to know what is okay and not okay, and what symptoms or feeling in their body that we should be paying attention to for kind of, yellow flags of like, hey, maybe this isn't super great for me, or red flag of like, ooh, this is definitely I need to stop this activity. I'm not ready for that yet. Okay?
So would you recommend someone at like 2
Mm-hmm.
weeks postpartum going for like a 3-mile walk?
Definitely not.
Okay. How do you, general guidelines, if you did want to
Yeah,
get, because walking is fresh air, it's connection to the real world, it feels so
100%.
good. So typically, what does that first like 6 weeks look like if you did want to get outside and start walking?
So a couple things. I recommend people start with 10 to 15-minute periods. Okay? Because a couple things that we want to be thoughtful of, again, is we are bringing in gravity that's bearing down on our system. And I'm going to use my handy dandy pelvic floor model here. Okay?
Sweet.
This is the front of the pelvis, back of the pelvis where the spine is. And I'm going to tip it forward so you can kind of see this pelvic bowl of where our organs are. Okay? So we have the bladder in the front, the uterus, and then we have the rectum in the back. Okay? If we've had a vaginal delivery, that went all the way through, right? That also, if we've had any tearing or anything, so here's the vaginal opening and then the anal opening. If we've had any tearing along this perineum here, that pelvic floor now is not able to support you well. So this entire system here now is getting extra pressure and bearing down that way, which can lead to other challenges later on, potentially leaking, pelvic pain, also potentially a prolapse if we're not being thoughtful of getting back to even just walking, and especially if we're walking while carrying our baby versus having baby in the stroller. Or what I recommend is if you want to go for a walk to go get some fresh air, have somebody else be in charge of baby if that's possible, whether that's co-parent or a family member or a nanny or postpartum doula, whatever it is. But can they maybe go with you and they push the stroller, or they wear the baby while you get to just worry about your body? Because if we're adding an 8 to 10-ish pound baby on average, right, on top of a system that already is stressed and is in a healing mode, that pelvic floor is already at a disadvantage. And now we're adding extra load to a system that's not ready for it yet. And now we're doing that over, let's say, a 3-mile walk. That's not setting our body up to be successful, nor is that helping with that recovery process. Now, that's not to say that I want them immediately themselves on bed rest. That's not the answer either. But we need to think about gradual loading of that tissue so that it can be successful. So hence why I say I start with a 10 to 15-minute walk.
Mm-hmm.
And again, ideally unloaded, meaning not having to wear baby.
Have daddy or a partner, right? Where
Yeah.
baby.
Have co-parent be in charge of baby.
Mm-hmm.
All right. So if you want to walk together, but also it might be nice for mama to go take a 10-minute walk by herself.
Absolutely.
Okay. So for mental and for the physical care
Yes,
there.
absolutely.
Okay.
Oh my
So
God.
yeah. And then what I say is start with the 10 minutes. And what I want people thinking about and assessing in their body is how is my breathing? I want you to be taking more deep breaths, because our breath connects directly to our pelvic floor.
Mm-hmm.
And that's like a big kind of aha moment for a lot of my patients that don't understand that oh gosh, okay, there's this pelvic floor and my breathing muscle, my diaphragm, they work together as a piston. So they're lifting and lowering with my breath. So if we're taking bigger, deeper inhales and exhales, that's actually helping to facilitate that pelvic floor. If we're keeping really shallow breaths up here, then that doesn't create that connection to our pelvic floor for support.
Awesome.
And then in addition to that, again, that gradual loading of that tissue, just like if we were, let's say, working in the gym, you wouldn't just go and pick up the 50-pound dumbbell to do your bicep curls if it was your first time back at the gym, hopefully, right? You'd do, okay, I need to start at the lower weight, and I'm over time, over the next couple of weeks, going to work my way up, right?
Absolutely.
Same thing in this postpartum period. So we need to be thinking of that gradual loading.
I love that.
Also, so our tissues have time to get used to that again, but also so we have space to assess if something doesn't start to feel good, we know where that break point is so we can start to kind of work within that frame. If we go too fast, too hard, then we don't know where that real boundary line is. And that's not helpful for continuing to work towards our end goal.
I love that. So instead of going from like, which is common, I see a lot, 0 to 60, it's like all or nothing approach.
Right.
You want to see some of that progressive overload. And that's kind of a hard one to describe, because what does that mean? What does that look like for someone, especially a really active person prior that was lifting super heavy, or a competitive CrossFit athlete? Going to like rehab-based exercise may be completely foreign to someone. They want to pick up that barbell or dumbbell and like, what weight do I start with, kind of thing. So what do you recommend instead of that 0 to 60? I like to say like the fourth there's things that we can be doing prior to that 6-week clearance. Yes. So what does
100%.
that gentle rehab-based exercise look like, so we are moving our bodies and facilitating a rehab process?
Great questions. So again, kind of back to that idea of like, if I could design what the whole kind of women's healthcare plan should be for this, in a perfect system, I recommend to my mamas, if they can, to connect with a pelvic floor PT during pregnancy, before you even have your baby, so that in that kind of the third trimester, you already kind of know what your exercise program is going to be for those early couple of weeks. So you're already well versed. You have a plan put in place with your pelvic floor PT on your team to help you understand how you should navigate that window.
Love it.
When you have that, the other helpful thing is you already have your teammate there with you to be checking in with. So a lot of times I have my mamas during that third trimester, we connect, we have their program all set up for them. I teach them to understand how their pelvic floor and their breathing is connected, how that is part of your core system, okay? And how we use that to re-educate that system that just brought a baby into the world. Because if you think about that abdominal system, it just had this drastic change. Baby was creating some intra-abdominal pressure that was giving the body a sense of stability. Baby immediately now is gone, and I treat it kind of like if you had a balloon that was fully inflated, you can kind of press on that balloon and it gives some stability. If you pop that balloon, now we've got a wilted balloon, and that's not giving me any kind of resistance back. That's similar to what happens with that core system when we have baby come into the world. Hence why people feel wobbly and weird and how can I not connect?
I love that.
That pressure system has completely been wiped out. So we need to re-educate that system of how to regenerate a healthy amount of pressure in our abdominal system to give us that core stability. And that's where we start those exercises in that early phase. That can be starting those first few weeks and is ideal really in that situation, to help the brain and the body reconnect to this new system and to help them understand how they can be re-educating that body back to a more familiar movement pattern.
I love that. The brain body connection, right? It's so
Totally.
powerful and underappreciated.
1000%. And I like to use the word re-educating and reconnecting versus rehab in that sense. Because I think rehab can sometimes have this negative connotation, and especially for us as athletes, you can be like, I'm more advanced than that. And it's not about you being broken. It's about you have a totally new body and we need to help it reconnect to then build off of. So I call it kind of like your movement prerequisites
I like
that
that.
we're reconnecting and reestablishing for your foundation to then be able to build off of. And that's really where that whole like 6-week green light, it should be about, oh, we're building the foundation here, not 6 weeks green light, go do all your movement before we have a foundation that's solid. So I
Amen.
described to my mama is about like, think of your pelvic floor literally as the floor of your house. If we have a cracked foundation, you can make it as pretty as you want on the outside, but we still have a cracked foundation that's not going to make that house livable.
Yes, absolutely.
We have to think about the foundation first before we worry about building anything else up around it. That's what those first few weeks are about. And also, not just pelvic floor and doing 1,000 Kegels, but reintegrating how does that pelvic floor connection connect with my breath, and how do I generate my abdominal muscles to connect with that, and also strengthening the muscles around the pelvis, because our glutes, our inner thighs, our hip flexors are all part of that secondary support team for that pelvic floor. They're the next kind of bolster underneath that main foundation. So we need to also be strengthening them. So doing kind of some bridges, some air squats from a chair, different things like that to start to build back up those muscles, as well as the mind, body, muscle memory of how do we use those muscles for these activities.
I love it.
A squat is a really helpful, important movement that I work on with all of my mamas during pregnancy as well as postpartum. Because how else are you supposed to get up off the toilet? How are you supposed to get out of bed? How are you supposed to pick up baby or a bag or groceries or anything off the floor?
The car seat, oh my gosh, the
All
strollers,
of
which are
it.
heavy. Yeah.
Yeah. So when people say to me, oh, like I'm not allowed to lift, or that's too heavy, or different things like that, or especially if we've had a C-section, there's usually that kind of like, don't lift anything over 10 pounds
Mm-hmm.
for a certain amount of time. While I understand that, I feel like that also doesn't help mamas because that's really unrealistic.
Mm-hmm. Mm-hmm.
Okay. And we need to be supporting mamas to say, okay, it's not realistic for me to say, don't pick up your baby.
Oh gosh, yeah.
How are you supposed to breastfeed? How are you supposed to do all the things? How are you supposed to do skin to skin when baby's crying, right?
Mm-hmm.
Okay. All of those things have to be supported, but there are ways to do that that can not be extra stress on your system when you have someone like a pelvic floor PT who's helped you be able to navigate and assess other options for how to do that safely, instead of leaving it to mama in those first couple of weeks where you're already overwhelmed learning a lot of new things and a new baby,
Mm-hmm.
to then also be going, how do I organize my body then to do that too?
Right. Oh my gosh. Great. I love talking about this. So here we have a brand new body,
Yeah.
and we often hear the advice, just listen to your body. You'll be fine. You'll bounce back.
Yeah.
So why might not that advice be serving us? Because if we do, we say this is our first delivery, especially even second, third, fourth pregnancies, delivery, who knows, each time
Yeah.
your body changes. So what
100%.
are we supposed to be listening for?
Great question. So this is also another question that I feel like is well intended, but not helpful. Listen to your body assumes that you know what to listen for. Okay. What is that? And also said every single pregnancy and delivery, even within the same mama, is different. So again, listen to your body may or may not still be helpful because it's likely not going to feel the same. So I feel like that phrase also puts a lot of extra pressure again back on mama to be making these calls and these assumptions of what's okay or not okay when they already didn't have the training on the front end to know what that is. So this is also where I go, okay, it's my job as a pelvic floor PT to help my patients know what to look and listen for.
Yeah.
Not their job to know on the front end.
Let's take
Okay.
it straight to pelvic floor. Like, why is it, what
Yeah.
is the pelvic floor? Because hello, Even in
Yeah.
your like birth prep classes, the only thing I remember about the pelvic floor is the dilation of your cervix, that image.
Yeah,
And that was
exactly.
maybe a little bit of tearing protocol if you were to tear like maybe like perineal massage, and that was it. But I'm like, what is your pelvic floor? Why should we even care about our pelvic floor? Like, what's so cool about it?
100%. I would first like to start that I also did not know really what the pelvic floor was, even after finishing my graduate level PT coursework. Okay. I remember sitting in that pelvic floor course that I told you about in the beginning of this discussion. And I remember them pulling up the slide of what our pelvic floor muscles were. And I'm like, that's in my body? Really? Okay, cool. I'm 28 years old and I'm just learning that that's down there.
Yeah.
Awesome. I felt embarrassed. I felt like, oh my God, I'm supposed to be a medical professional and I'm just learning this now up here on the board. Like, that's embarrassing. And also how unlike helpful that
Yeah.
I've gone my entire life so far. And this is now the first time I'm learning about this. And I found most of us ladies, this is the situation. So I say this just to like, help everyone not feel shame or embarrassment about not knowing that part of their body or learning it after they've had a baby. Because when else have we been that intimate with that space? Right?
Absolutely.
So no need to feel bad. I'm going to use my pelvic model again because I feel like visuals are helpful. So again, we have the front of the pelvis here. We're looking kind of down inward, right? And we have the internal organs that are sitting here. So bladder in the front, uterus, and then the rectum in the back. I'm going to take all of these internal organs out so you can see the beautiful construction of the pelvic floor that never gets enough credit, by the way, okay? But this is an entire muscular sling that sits in the bottom of our pelvis, okay? And it attaches all the way on the inside. It runs all the way across and also forward to back. So it's literally like a hammock, okay? That entire pelvic floor system is 3 layers deep, and it controls bowel, bladder, sexual function, and this is also the bottom foundation of your core stability system. It is not just that six-pack ab muscle, okay? Our core system is actually made up of something way more complex than that six-pack ab muscle. The deep core system is made up of your pelvic floor, the transverse abdominis that runs horizontally underneath that six-pack ab muscle, the diaphragm that sits underneath our pelvic, or underneath the rib cage, rather. And then we have multifidi, which are our deep back muscles that run along the spine. Those 4 players create your core system. So when we're not talking about the pelvic floor or thinking about the impact that the pelvic floor just went through pregnancy and delivery and how that affects our body's ability to create a strong base, we are missing a huge piece and giving women a huge disservice in terms of how they are supposed to recover and how they are supposed to return to exercise and higher impact activities.
Incredible. We have matching pelvises here.
Yes. Right?
I love it.
So helpful and important.
It's so helpful to see, because when you're like, pelvic floor, what does that even mean? What does that look like? So just to get that illustration, even the bottom part is like, whoa,
totally.
that's eye-opening in itself.
Yep.
So let's talk about
entire,
okay, yeah, good. Like function of pelvic floor and kind of relate that to how prevalent incontinence and leaking is. We'll just kind of stick in that area.
Yep. Perfect. So other thing that I feel like a kind of common myth that people think is that, tighter is better all the time for a pelvic floor. Okay. Our pelvic floor is not static, meaning it does not just stay in one position to provide support. It is dynamic, meaning that it is constantly changing and approximating for whatever activities we're doing. So if you think about when you go to, let's say, pick up a pillow versus pick up a heavy bag of groceries, we need a different amount of core pressure that's developed in our abdominal cavity to give us stability to be able to do that activity, right? The pelvic floor is adjusting also when that pressure system is adjusting. So this pelvic floor, I like to describe to people as, think of your pelvic floor like a trampoline. If you had a trampoline that was stiff as a board and you try to jump on it, that's not going to feel super good.
Right.
Okay. Just like if you had a trampoline that was too much on slack, that doesn't work either. We need that trampoline to be able to spring back so that we can jump on it. Same thing with our pelvic floor, because as we're moving throughout our day, that muscular trampoline is responding. If we don't have that type of coordination of that trampoline of our pelvic floor, that's when we have issues. If it's too lax, we don't have enough support, right? And that can create pelvic pain. That can also look like prolapse sometimes, or that description of heaviness in that part of the body, right? That means that we need more support. If we're too tight and don't have that kind of flexibility, then we can also have other issues in terms of pelvic pain. We can also have pain and dysfunction that is uncomfortable with penetration, with intimacy. Things like leaking can actually happen in either case. Sometimes if something's too tight, then it's not giving that bladder or that rectum enough space to kind of give a little bit when we're doing our activities, and therefore we have a leaking episode. Or if that pelvic floor is too lax, again, there's not enough support there, and that can also impact our ability to control bowel and bladder for when it's an appropriate time versus not. So it kind of depends on the situation, but I find leaking urine is more common than leaking a bowel movement. And often too, when we're thinking about higher level activities, especially like jumping and running with urine leakage, and I'm going to put my bladder back in my situation. So that bladder sits more into the front of this pelvis, okay? And I'm going to take my model and I'm going to turn it to the side. And if you think about when we're carrying through pregnancy, as baby grows, that pelvis starts to tip forward, okay? Which naturally needs to happen to accommodate baby's growth. When that happens, we've changed the line of gravity of where it's bearing down on that pelvic floor. So when we're more in neutral, that gravity is bearing down on the entire pelvic floor system. So that whole hammock is being challenged, which distributes the workload. As our pelvis tips forward through pregnancy, now that line of force is more through the front of that pelvic floor, right over the bladder. Hence why urgency frequency increases as baby grows. Also, baby's taken up a lot of real estate, okay? So that bladder doesn't have enough space usually to fill fully, so that's also contributing at that point. But now we're going to imagine baby has come into the world. This tipped forward pelvis doesn't know to just revert back unless it's educated, like from someone like me to help you re-engineer and re-educate how that muscular system and that alignment is supposed to look. It stays here, which then if we now take this alignment and we add jumping and running to it, we're right over that bladder and we have a leaking episode. And then we wonder why. That becomes an issue. Okay. And this can happen months and sometimes years after a baby. Okay. If this is not re-educated, this is going to be the system that the body is using for those activities.
How prevalent is leaking? 1 in 3? Is that stat right?
At least. And I would argue more because there's a lot of underreporting because people are embarrassed to admit it.
Yeah. So this is a super, super common issue, but one that can be improved and managed, right?
Significantly.
So
yes.
There is this mindset that once you have baby, that's just the way it is. That's my normal. I'm going to go right to the bathroom before I exercise, maybe even during. I'm going to stick to wearing my black pants. Maybe have to
I'm going to wear my pad.
Yeah. So it's just something that women have dealt with. And whether or not that's a lack of information or education, I just want women now to know that there is so much help and support and can be improved significantly. So quality, I mean, 100%. It affects quality of life so much.
Yes, 100%. Quality of life is a huge piece. And also just because something is common amongst a lot of people, or in this case, leaking is common amongst moms, I understand the assumption that common means that I should now just that's typical now for me to experience, or that I just need to accept as my new normal. That is not the case. There is a lot of leaking and things that are happening because of everything we've talked about previously in terms of a lack of good understanding and education around a lot of these topics, and a lack of helpful support in terms of how to recover through this initial postpartum period.
Mm-hmm.
And I also want to say too that there is no expiration date on when you can get help from a pelvic floor PT. And I will share a brief story here about my own mom.
Yeah.
So I went to my pelvic floor course, that first one I mentioned in the beginning of this interview, and came back and was like, I'm so excited. I can't wait to like keep doing this path. And like, this is going to become a big part of my practice. And I want to become an advocate for my, my fellow ladies. And my mom is super sweet and always loves to geek out with what I'm excited about and always asks me what's going on. And so I happened, like, I don't know, a week or two after I took my course, I happened to be going home and visiting her. And I went home and I'm telling her all about it. And she was super excited. And then I started to mention about leaking and incontinence, and her whole face just like turns white. And I'm like, Mom, you okay? Did I say something? And she was like, I'm just, this is such an important thing that you're doing. And I'm so glad that you're going to be helping women not have to deal with this like I've had to deal with it. And I'm like, what do you mean? And again, I'm like 28 at this point, and I'm the first kid. My mom, there are two kids in my family. And she goes, I had a, full 3rd-degree tear of her perineum. And my mom had suffered with urinary and fecal incontinence from the time that she had had me.
For years.
And she's telling me this, and my heart is like sinking and breaking, knowing that my mom has been dealing with this for her whole life and has just had to accept it as her normal because other medical providers told her, yep, that's just the situation. So my mom lives out of state from where I live. And so immediately I get on the computer and we Google and we find her a pelvic floor PT. And I'm like, Mom, this is fixable. Like, you are not past an expiration date. Like, I want to get you the help. Are you open to this? I explain the whole thing. And she's like, yeah, but like, you really think that this is going to be helpful at this point? And I'm like, yep, 100%. We got her set up with a pelvic floor PT in her area. She, within 9 months of pelvic floor PT, she is at like 95% recovery.
Amazing.
Amazing. My mom also, I should preface, is like the perfect patient where you like tell her what to do and she like follows it to a T.
Yeah.
Okay. And also I say 9 months, not in the sense it will necessarily take other people that long, or maybe it will take longer, and that's totally okay. But that was not on a like 2 to 3 times a week having to see the PT kind of thing. She started for like the first month or two going once a week. And then it started kind of spacing it out to like once a month, once every 3 months. And it kind of just worked out so that she kept doing her homework and then touched base back in and was able to kind of get the support she needed through the process while doing her own work in between. So there is no expiration date on when you can get help on this. And again, if I were in charge of how this plan of care went, this is why a pelvic floor PT should be automatically part of the medical team to help mamas be able to make these decisions so they don't have to experience leaking, so that they don't have to wonder what's normal or not normal, so that they can get that foundation rebuilt for them in a solid way instead of having to work around this less than stable system and then wondering why things aren't working.
I love that you brought that up, because we have a lot of female clients that are in their like 40 to 60, and they still enjoy running, but they're still wearing pads. They are experiencing so much pelvic pain. And then you get into the menopause stage, right? So that's another stage we go through later on in life. And that's when, so even if you aren't experiencing symptoms now, right, you can be experiencing them later on, but being proactive.
Absolutely.
And I love that you say it's never too late. You can always
never
do
too late.
Some work. It may take some time. You may have to put in some work. It's not going to be easy, but there's solutions.
100%. I always say it's always more helpful the sooner you can access someone like us, so that we can help from an education standpoint and also just give you the appropriate tools to know how to best support your system. But there is still never I'm X weeks or years out from having my baby, so I'm a lost cause. That is not true at all.
Excellent. Good. Let's
Yep.
talk about your guidelines for return to running. I know this is kind of a big, broad question, but just kind of like your protocol, your
Yeah.
suggestions for if we do have mothers that want to return to running post baby, what are the steps that
Yes.
they should be taking, generically speaking?
Yeah. Great question. My first thing is whether or not you had a complicated pregnancy or delivery, number one, find a pelvic floor PT so that we can help you take the guesswork out of it. And bonus points if you can find a pelvic floor PT that's also a running specialist. We're a little bit of a unicorn, but it's helpful to be able to connect with one. And sometimes you may need to connect with a pelvic floor PT to make sure that that foundation is coordinated. And then you might need to be referred to a sport PT that specializes in running. But
Okay.
having that connection between the two is really helpful if you can't find someone like me that's the hybrid.
Awesome.
With that being said, how I navigate it with my patients is first, I'm all about we need to reconnect your pelvic floor to your core system and have that reflex reestablished. If we don't have that reflex reestablished, everything else is not going to work as efficiently. And eventually there's going to be a breakdown in the system. Okay. So I make sure that we know how to properly connect our pelvic floor, that we have not just the connection, but also endurance. So we need to be able to connect that pelvic floor with our breath. And then we also need to be able to connect that pelvic floor, and we need to be able to sustain that contraction for a 10-second hold
Okay.
while we're breathing. That's way harder to do than most people think.
Mm-hmm.
Okay. So there's the initial, can I connect my pelvic floor? And then can I connect it and then have some endurance?
Love it.
Okay. That 10-second hold is the gold standard in the pelvic floor PT world of if
Okay.
that muscular contraction can hold for 10 seconds, then it typically has more of that resiliency than for that kind of trampoline theory I was mentioning earlier for those higher dynamic activities.
Awesome. And do you do
So
biofeedback for that usually?
I myself do not have a biofeedback machine in my office. If you work with a pelvic floor PT that has one, they're helpful. But I find that the best way for me to train that with my patients is honestly using my own hand and
Okay.
assessing how are they connecting. And I have them in different positions. So kind of similar to what we had in the beginning, I may do my initial assessment with my patient on their back, but then I have them on hands and knees. I may have them in a squat position and different things to assess different positions of that body against gravity are going to affect how that pelvic floor responds. And how often are we moving in our day on our back versus in other positions? So I'm
Absolutely.
all about functional positions.
Good.
We may start on our back, but I need to get that body up and vertical and against gravity in a more functional way for this training to be helpful for them in the day-to-day life.
Absolutely. Yeah.
So if you end up working with a clinician and they're only helping and training you on your back, ask for them to help you train in other positions. And if they don't know how to do that, find another pelvic floor PT.
Good.
Okay. And also, I should preface too, if you start with a pelvic floor PT and you're not being successful in the way that you want to be, and you try to communicate again with them of what's still limiting you and it's not working, don't assume that you have failed. Find another clinician to help you.
Good.
There's more than one of us.
Good.
Okay. So I always also say
Don't
that
give up.
too. Don't give up. Okay. You might have to go through a couple of us before you find your person, and that's okay.
Yeah.
So know that that's sometimes part of the path too. So yeah, don't let just a one and done be the exit.
Cool.
Okay. So I start there with my clients, and we're also then working on strengthening the muscles around the pelvis.
Cool.
So our glutes, inner thighs, hip flexors, because those are all contributing to that secondary support system of that pelvic floor and also contributing to the position that pelvis is in. So that's also helping to create a more successful load through that pelvic floor.
Awesome.
All right. So I
Connection,
start there. Yep.
endurance, strength training.
Yeah.
On the hips.
So instead of just going straight to the cardio situation, and again, back to our discussion of like bounce back and wanting to lose the baby weight, I totally get that. Focus on your strength training and building back your base of strength before you even worry about the cardio component.
Amen. Okay.
Okay. That is your number one priority. And also, just from a metabolic standpoint, you're going to help your metabolism actually be more functional with strength training than just the cardio.
Awesome.
The cardio without the strength training just wears and tears down the system.
Okay.
Not going to help that body be successful. Because also, mama, by the way, you are weight training all day long, picking up that little one, picking up the stroller, the car seat, the grocery bags, the laundry, all the things. You need strength training to help you be successful there, not running yourself into the ground on the elliptical machine.
Awesome. Do you recommend just going at that point, like for a run, or do you want to do some incline work, like walking inclines, hill sprints, like shorter intervals? What do you suggest from that point?
So what I do with my mamas is I have them just focus on strength training for a good 4 to 6 weeks. And I'm talking like a 20 to 30-minute strength training program a few times a week, alternating days. And as that strength is building up, then we're gradually increasing the walking tolerance, right? A little bit of uphill is helpful, but I want to minimize the amount of downhill because that just puts more pressure down on the pelvis. If we have a treadmill where we can control an incline and then go to flat, that's kind of the most ideal because then we don't have to do the downhill.
Got it.
Right? Until we get more training and strength into that situation, because downhill is cardiovascularly not challenging, but from a loading perspective on that pelvic floor, it is a high load that often gets shifted to the front of that pelvis, and again, leaking and extra pressure that could create a prolapse situation.
Okay.
So I like to focus more on the strength building, getting their body to reconnect with that center, understanding where that more neutral alignment is, rather than what we call that kind of anterior tilt of the pelvis that's tipped forward, so that they can be really successful, because that's the alignment that I want them to then take with them as we start to ease back into jumping and running.
Okay.
So if we don't already have that established, then we're going to hit that wall again and not be successful. So I'm focusing on the strength there, and then low impact cardio as we're going through that if they really want to do some cardio. Plus, it's also just nice, yes, to kind of get a little sweat on and things like that. So again, 20 to 30 minutes, I start there. So again, we can kind of assess how are you feeling and tolerating that.
Awesome.
And when I say low impact, that can be walking, that can be cycling, spinning in the saddle, not out of the saddle. Yeah. As well as, let's say, yes, an elliptical or a stationary bike. Those kinds of things are pretty safe for the most part, and stuff like that. But kind of thinking of those, and swimming if you like swimming and have access to a pool. So those are things that I kind of recommend and create a little plan for my mamas that way. And then after that kind of like month to 6 weeks of strength training, and I'm assessing how that progression's going, if we're at a place where that's been going really well and they've, they've mastered some of those good mechanics of squatting and different stuff like that, then I'm starting to say, okay, how do we tolerate some jumping? So I may put like kind of 10 seconds of double leg hopping, a little bit of small jumping jacks to start to kind of get things mixed back in, because now we're assessing, all right, how does our body do from a static loading controlled squat versus a little bit of a hop? That's a totally different mechanic organizing that the body has to do, as well as we're now adding a little bit more dynamic force to that pelvic floor. So that trampoline effect is different for the double leg hop than it is for a controlled static squat, for example. So we're starting to load double limb. As that starts to become more natural, then I start to add in single limb hopping. As that starts to get better and more controlled, and we're again not having any symptoms as we go through this, then I start to go, okay, now we're in a better place to start thinking about a return to run walk program.
Okay.
Then we're doing our run walk kind of switching off, where I have them run for a minute, walk for 4, run for a minute, walk for 4. And I'm giving them typically about a 20-minute workout with that. So they're doing about 4 rounds of that 5-minute increment.
Okay.
And then each week I'm adding 1 more minute of running, and I'm taking away a minute of walking. And then eventually we're getting them to a continuous 20-minute run, and then we start to build from there. So it's gradual, again, for that tissue to have time to acclimate, also to reduce risk for overuse injuries. Because the other thing that's really important right now postpartum that a lot of people aren't really thinking about out is you still have a lot of hormonal changes that are happening. If you're breastfeeding, a majority of your calcium is going to baby. So the risk for stress fractures and overuse injuries is super high for mamas at this point.
Oh, such a good
if
point.
we're not being thoughtful of gradual loading. So I know, and me as a runner, I love to run. It's my stress outlet and all those kinds of things. But for mamas, if we're not being thoughtful of those pieces, you're going to get sidelined for way longer.
Mm-hmm.
Okay. But also we have to give your body enough acclimation time to be successful.
I love that. Like Brianna Battles has mentioned, the slow way is the fast way. Build that
Yes.
foundation, progressively overload the system, and you're going to be leaps and bounds ahead of the game and progress a lot faster than you think you can when you set that foundation.
Absolutely. And you're going to be, a lot of my mamas, so I work with, end up running better and faster postpartum because they didn't have all that good training usually before.
Mm-hmm.
So you can actually, a lot of times, end up being stronger and more efficient in terms of your movement if you're willing to commit to that little bit of that slow and steady build to then have a pretty good increase in trajectory within about a 6 to 8 week period.
Love it. So cool.
So patience is a virtue in the beginning, and knowing that we're putting down the building blocks to be successful. So that time frame on average, if I have a mama that already kind of knew me a little bit third trimester, knew what her program was initial in those first couple weeks, has a check-in with me around that 6-ish week, we're strength training and doing all that kind of stuff with low impact cardio for like another 6 weeks. Then when we're starting to do that kind of return to run, we're at about a 3-month postpartum window.
Which is early, soon. I mean,
yeah,
that's quite quick.
It can go by really fast. All right. Now, that's also to say a lot of mamas will take a little bit more than that.
Mm-hmm.
Some may feel really good before then and want to try to run. I'm going to urge you to sideline that urge. Even though you feel great, and even if you've had an uncomplicated delivery, that tissue still has not reached maturity because it takes a good 3 to 4 months minimum for that tissue to reach full healing.
Oh, I like that you brought up that point too, because I had everything was great. It was uncomplicated, kind of picture perfect birth, and you still have trauma to that area.
That tissue still needs a window of time to heal. Mm-hmm. So if we're not being thoughtful of factoring that into the system, we again are setting ourselves up to not be as successful later on, or to wonder why the wheels start falling off. Right. We need to honor that tissue healing window. And that doesn't mean that you don't get to move. It just means we have to be thoughtful of the volume and the intensity.
Yeah, this is all such great information. I always say, I wish I would have known. That's why I want to have these conversations, because there's so much I wish I would have known, even with my pregnancy and delivery, like immediately after. I was one of those that was like, cannot wait to get back into the gym. As soon as I got my clearance, I was doing what I was doing before because I didn't know any better. I didn't have the tools. I didn't have the resources. So we're paying that forward now, because mothers deserve to know this information. They do.
1,000%. Yeah. And we shouldn't have to learn the hard way. We shouldn't have to learn retroactively. And for ladies like you that are paving the way to say, hey, this happened to me and I want it to be better for you. Like, thank you, my dear, for doing that, because we need more mamas to say that and to kind of blow the whistle and be like, hey, this is not the best way to do this. Yeah. Because the more that we can advocate in that way, the more that women know that they have better options. And that's really what this is. Better information.
Empowered. Yeah.
Yes.
Educated
exactly.
and empowered will take you so far with your recovery, 100%. And especially later on in life, because it's not just about right now, it's years from now.
Yeah. 100%.
I love this connection as well, because I've worked locally with a lot of pelvic. So we have 2 locally, and it's the best team, because we're on like text message basis, where if my clients go see a pelvic floor PT, we can communicate back and forth and can really dial in specifics on they're training. So it's a win-win for everyone, and it's amazing. It's
Yes.
incredible. So I
I
appreciate
love the team
this
effort.
relationship between like postnatal fitness specialists or personal trainers that have this sort of education and experience working with pelvic floor PTs. It's like the perfect team.
It totally is. And it makes all of like the work together so much more streamlined. I love when I get to work with other prenatal and postpartum fitness specialists with my clients because everybody wins. We all have a certain amount of expertise to bring to the situation. We get to see different things in real time together and we can troubleshoot together. It's not a me versus them, it's a we. How do we make this situation work the way that we need it to? How does this mama need support? What's working for her? What's not? How do we adjust it? And
Absolutely.
being able to work together like that helps everybody reach their goals faster. And that's my favorite way to do it. I love that.
Makes my heart
And
happy.
most of us pelvic floor PTs, we love for other movement professionals to reach out to us too. So if you're a movement professional in this space, whether you're a new mama yourself or, you know, just work with mamas and want to have that relationship, I encourage you to reach out to anyone, and I'm happy to also serve as a resource for you too. But, you know, connecting with other people locally in your area is awesome. And the more that we can connect, the more people know how to access the support that they need, and everybody gets better.
Absolutely. So I mean, you are a wealth of information. How can we find you, connect with you? Do you have a blog, Facebook page? How do we
Yeah,
connect with you?
great question. So social-wise, I am on Instagram at Pieton PT, so my last name, Pieton PT. And then on Facebook, you can find me on my personal profile, my actual name, Christine Pieton. And then I also have a free Facebook group that I started recently to help spread the knowledge around all the things we just talked about. Because again, I have had my own challenges of being frustrated in terms of this information needs to be more public knowledge. How do I help? How do I make the situation better? So I decided to make a free Facebook group called Mama Runs Wild. And in that group, we talk about all the things. And I do a variety of different kind of informational videos and discussions and all kinds of stuff to help serve as a resource so you can ask your questions, get some better information instead of just diving into Dr. Google and seeing what the heck comes up. Because when you do that, there's a lot of unhelpful information and misguided information that comes up that way. So I want to try to kind of debunk a lot of that misconception and help women know what their true options are. So I would love for anybody who is interested, and that's also for mamas, but also what I call my mother runner allies. So anyone that works with mamas that wants to learn more about this or has questions, you all are also welcome to join the group too.
So cool.
So yeah, so please come join us. And we have lots of fun discussions in there and things. And I'm a little more active in there just because of the platform and being able to talk and connect better than what Instagram kind of allows. But you can find me or message me anywhere through either of those platforms to connect. And then I do have a website and a blog and things like that, but these two social options are the faster and better way to get a hold of me.
Okay.
My website is just pietonphysicaltherapy.com. And my blog is there and information about my clinic and things like that too.
Okay, awesome. Oh my gosh,
Yeah.
this was amazing. So much information. I know it was a lot, but
Yay.
super, super helpful for mamas especially. I
Good.
can't thank you enough for your time. So
You're
thank you for
welcome.
joining me in this
Absolutely. Thanks
conversation.
for creating the space to talk about it.
Of course, of course. Well, we will be in
Yeah.
touch. I know, I'm sure there's more to come from this.
Always happy to talk anything pelvic floor and women's health. You don't have to twist my arm.
Anytime we can use our pelvic models, right?
100%. My pelvis right now in chronication is living on my mantle in our living room. So I was like, why haven't I put her here before? She deserves to be on a pedestal. So she's living there right now.
I love it. So mamas, make sure you connect with Dr. Christine and we will be in touch. Thank you.
You're so welcome.
And take care.
Bye, lady.
Bye-bye.